sometimes the most unexpected little things can remind us just how amazing and unpredictable the human body really is. Take, for instance, something as simple as a cyst that shows up under the chin. To a lot of people, it might look like a minor nuisance, just a small lump that maybe doesn't hurt much and could even be ignored for months, sometimes years. But when we really take a closer look, that little bump has a story, and that story often says more about our bodies, our habits, and even our sense of self than you might think at first glance. Now, I've met countless people who come in feeling a little embarrassed. They sit down, almost apologetic, and they'll touch their chin lightly and say something like, I've had this thing for a while. It's not really painful, but it's bothering me. And I can see right away that what they're really saying isn't just about the physical bump. It's about how it's been sitting in their mind. Every time they look in the mirror, every time they laugh with friends, every time someone's eyes wander just a little too low during a conversation, they feel it. It's not always about pain, it's about presence. That constant awareness, that reminder. Something's there that shouldn't be. What makes cysts particularly fascinating is that they're such a simple concept biologically, yet so layered in meaning when you think about them in the context of real life. Technically speaking, most of these are epidermoid cysts or pellar cysts. Basically, tiny sacs filled with keratin, that protein that makes up our skin, our nails, our hair. Keratin is supposed to be on the outside, protecting us. But when it gets trapped underneath, it just builds up, slowly, quietly, almost sneakily. You don't feel it forming. There's no little alarm bell that goes off. And then one day, you just notice a lump, and it feels like it appeared out of nowhere. It's like a secret your body was keeping from you until it couldn't keep it anymore. Now, under the chin specifically, that's an area that gets underestimated. People don't realize just how noticeable even a small change can be there. Our chin is like the punctuation mark at the end of our face. It frames a smile, it balances our profile. It's a focal point whether we realize it or not. So when a cyst decides to move in under there, it's not just a little lump. It can feel like an exclamation point on your insecurity. I can't tell you how many times someone has told me they've stopped wearing their favorite jewelry, or they adjust the way they tilt their head in photos, just to try and keep it hidden. And that breaks my heart a little, because something as harmless as a cyst, something the body made by mistake, ends up hijacking confidence. What's interesting too is how we as humans tend to deal with these things. Some people are avoiders. They'll say, it's not hurting me, so I'll just leave it. And for months, maybe even years, they carry this little secret under their skin. Others are pokers and prodders. They'll try to push on it, squeeze it, or pick at it, and that never ends well. Because what happens is, even though the temptation is strong, you see a bump, and your brain thinks that should come out. The body doesn't work that way. You might get some keratin out, maybe even a bit of that cottage cheese, like substance that cysts are known for. But the sac, the lining of that cyst, it stays behind. And when it stays behind, it just fills back up again. So you end up in this cycle of frustration. People tell me, I thought I got rid of it, but it came back, even bigger. And I nod, because that's the nature of it. It's like trying to pull a weed without getting the root. You can't be surprised when it grows right back. Now, what makes treating a chin cyst unique is that it sits in this spot that's both cosmetic and functional. Think about it, your chin moves every time you talk, every time you chew, every time you smile or laugh. It's a mobile area. So if the cyst grows large, not only is it visible, but it can start interfering with movement. Some people will say it feels tight, or they notice tenderness when they stretch their mouth wide. And there's another little twist. The skin under the chin is thinner, more delicate. That means if a cyst ruptures there, the inflammation can spread quickly. Suddenly what was just a small lump can become red hot, painful, a whole ordeal that forces you to deal with it, whether you were ready or not. When someone finally makes the decision to come in and have it removed, there's this look I see so often on their face. It's a mix of nervousness and relief. Nervous because they've lived with it for so long and they're finally about to confront it. Relief because they know it's not going to control them anymore. And that moment when the cyst finally comes out, when the sac is gently teased free, intact, and lifted from under the skin, you can almost see the weight lift from their shoulders. It's not just about removing tissue, it's about restoring peace of mind. And honestly, that's what makes this work so rewarding. It's not the pop or the wow factor of what comes out. Though I know that's what fascinates so many of you watching. It's the transformation in the person attached to it. There's also this wonderful educational opportunity every time a cyst is removed. People often ask, why did this happen to me? And the truth is, it could be genetics. It could be trauma to the area. Sometimes it's just luck or bad luck, depending on how you look at it. The important thing to remember is it's not your fault. You didn't do something wrong to deserve a cyst. Your body just made a little detour in its normal process of shedding skin. And that's a message worth repeating, because so many people carry shame with them, thinking these growths are a reflection of hygiene or lifestyle. They're not. They're just biology being quirky. Now, the actual removal. It might look simple when you're watching, but it's a dance between precision and patience. You can't rush it. You have to respect the tissue, respect the fact that you're working in an area that's not just cosmetic, but functional. That chin moves constantly, so you want to make sure the scar is minimal, hidden in a natural crease if possible, and that the person walks away not just cyst-free, but feeling like the chapter is closed. Because that's the goal, to close the chapter. To say, this was here, it's not anymore, and I don't have to think about it again. One of my favorite moments is when someone comes back for a follow-up and they've forgotten what side of their chin it was even on. They'll laugh and say, I can't believe I let that bother me for so long. That's when you know the job is done, not just physically, but emotionally. Because the real healing isn't in the incision closing, it's in the person reclaiming their confidence. And let me leave you with this thought, these little bumps, these cysts we carry around, they're part of being human. They remind us that our bodies are constantly at work, constantly renewing, repairing, and sometimes making mistakes. But every mistake is fixable. Every little hiccup in the system is an opportunity, not just to heal the skin, but to remind ourselves that imperfections don't define us. They're just part of the journey. And when we deal with them, whether it's a small chin cyst or something much bigger, we're not just removing a problem. We're choosing to show up for ourselves, to take care of ourselves, and to not let something so small steal something so big, like our joy or our confidence. So yes, a chin cyst might look like just a lump, but when you peel back the layers, literally and figuratively, you realize it's about so much more. It's about patience, trust, transformation, and that incredible sense of relief when you can finally say, it's gone. And if you've ever had that feeling, that moment where something you carried with you silently finally gets lifted, you know just how powerful that is.